Thank you very much, and we will continue with the next talk related to the cornea, and this is the talk related to treatment of keratoconus and several new technologies that are coming from our clinic.
It's not working. Maybe it's other.
Okay.
My last one. Thank you very much. And good afternoon, dear colleagues. And in the beginning, I want to say that I am so glad to take a part in this grandiose All Indian Ophthalmology Congress, and I was glad to present my speech today. And today we are going to discuss three prospective methods for keratoconus treatment. Is for pediatric keratoconus in child, for advanced keratoconus, and for prevention of recurrent keratoconus and ametropia after keratoplasty due to keratoconus. And let's start from children. And I want to say that the course of keratoconus in childhood is characterized by great aggressiveness and high rate of course. And corneal segment implantations have been successfully used since the 19th years in the treatment by progressive keratoconus in adults, but in children since 2005. And UV cross-linking in children has been used since 2008. And my presentation is based on my personal experience since 2012 intracorneal ring segment implantation and corneal cross-linking for kids. And I want to say that keratoconus in childhood is characterized by the development of amblyopia, which is permanent outcomes in adulthood. And so I think that we must treat keratoconus in child as early as it is possible. I think so. And based on the previously mentioned factors, we proposed a combined technique, intracorneal ring segment implantation with a corneal cross-linking in childhood on 30 eyes. Maximum follow-up period is 1 year. As you can see, the first step is femtosecond assistant intracorneal ring segment implantation. The second step is then mechanical epithelium removal, and the third step is installation of riboflavin solution into the interstromal channel. Finally, EPIOF cross-linking we proposed. Our research is based on corneal cross-linking in childhood and 70 eyes. Maximum follow-up period is 10 years. 52nd assistant intracorneal ring segment implantation in 75 eyes, and maximum follow-up period is 12 years. And presented 52nd assistant intracorneal ring segment implantation combined into one step. It's operation with the corneal cross-linking in childhood, 30 eyes, maximum follow-up period 1 year. And we compared three different methods, and you can see that dynamic of visual acuity is faster in the method of one-step operated and intracorneal ring segment implantation and UV cross-linking. And you can see dynamic of keratometry, dynamic of corneal thickness. And as results, in all cases, there was stabilization of keratoconus and improvement of clinical and functional results, and progression of keratoconus was absent even at the longest follow-up period up to 12 years. During intracorneal ring segment implantation, BCVA and UDVA increased for a long time, which is extremely important for the formation of the visual analyzer in the childhood. We recommended the maximum positive dynamics in the group on one-stage treatment. This includes a significant increase of visual acuity and decrease of keratometry data. So to recap, combined techniques give us the early visual acuity gain with the 1000 stabilization of the process. The post-operative period is less stressed. The proposed method reduced the number of hospitalization and anesthesia. No one of patients needed in keratoplasty at all or follow-up period. And the next technology that I want to present today is the femtosecond assisted keratotomy combined with the corneal cross-linking with the patients in keratoconus. And I want to say that this method was proposed by Professor Feder, but was not widely used due to the fact that in the arsenal of surgeons there was no femtosecond laser surgery and cross-linking. And now we recommended this method for patients whom cannot be performed intracorneal segment implantation due to a thin cornea, but who do not yet have corneal opacity. And support of our words, we present two histological data from patients with keratotomy with normal scarring on the left and in patients with the keratoconus. As you can see, we note the third type of scarring is a patient with keratoconus. To prevent this situation, we recommended perform cross-linking after the laser incisions in one operation. It's combined technology too. And we were the first who developed patterns for applying non-perforated radial incisions using femtosecond laser. We present the video. The first stage is the formation of radial incisions. The second stage is the opening the incisions with a spatula and filling them with the riboflavin after incisions. And after that, we perform the ultraviolet cross-linking, and as a result, the central part of corneals is flattened. Yes. And our study is based in so small analysis is results of 5 patients only with advanced keratoconus who underwent femtosecond assisted keratotomy combined with the corneal cross-linking. In all cases, the progression of keratoconus was stopped for 2 years, and refractive power of corneal decreased, while the thickness of cornea remained unchanged, which indicates stabilization of the process. And I want to say that the number of cases, of course, is extremely small. Preliminary results show the effectiveness of the method, but it's so small the number of cases, of course. The long-term results with the follow-up period of more than 2 years are presented, and the proposed methods makes it possible to avoid this significantly delay keratoplasty even in the advanced stage of keratoconus, and cross-linking and implantation of corneal segment is not recommended due to non-compliance with the selection criteria. And this method requires further research, of course. And the last method that I want to present today is femtopenetrating keratoplasty with intrastromal ring implantation. And the main criteria for the success of performed keratoplasty is the achievements of graft transparency. However, it's becoming increasingly important to achieve high clinical and functional results after surgery, which directly depends on the degree of ametropia of the operated eye. And I want to say that from 6 to 11% probability is recurrent keratoconus several years after surgery. And the causes of post-keratoplastic ametropia is included the preoperative and intraoperative and postoperative. And methods of intraoperative prevention of keratoplastic ametropia we can see on the slide. And I would like to recall Dr. Krumeich's methods. He implanted a ring between the recipient's residual cornea and the donor cornea, and then performed ring removal during suture removal, which had no effect in preventing of postkeratoplastic astigmatism. And firstly, we performed our technique on cadaver eyes, and after we operated 20 patients, and maximum follow-up period is 5 years. And according to our technique, after cutting our mushroom pattern, the femtosecond laser exfoliates towards the residual corneal stroma of the recipient, forming a lamellar pocket where the intrastromal ring is placed, and the disc of donor tissue is fixed then. The results you can see on this slide, and we compared with the standard femto PK and manual PK, and we noted an earlier increase of visual acuity. And it's interesting that we had an opportunity to take the complex graft and residual corneal tissue of the patients with recurring keratoconus for histology examination during the rekeratoplasty. And I want to say that we prove that the recurring process starts from the residual stroma. And our techniques give us the earlier improvement of visual acuity. And now prevent secondary ectasia during ring allocation in the recurrent residual stroma, and the follow-up in 5 years, no protrusions or dislocations of the ring were detected. And in conclusion, I want to say that today we have presented 3 new debatable, of course, techniques for the treatment of keratoconus in various stages. This have demonstrated what? The stabilization of the process and early improvement in visual acuity. And however, this techniques is needed to more examination and confirm the safety and efficacy. And I want to in the end, I want to say that the motto of our teacher, Professor Svetoslav Nikolaevich Fedorov, was "the beautiful eyes for everybody," and this word is our motto in our work too. And thank you for your attention.
Thank you very much. For the sake of time, because the session